It is estimated 1 in 8 seniors over the age of 65 has some form of devastating dementia. This makes it very likely you know someone living with dementia or may be at risk of development yourself. Commonly, the term Alzheimer's is used as a blanket term to describe all dementias. This is a misnomer. It is estimated that 15 million Americans live with dementia, and of those, Alzheimer's affects approximately 4.5 million. By 2050, it is thought the number of individuals battling dementia could reach in excess of 100 million, with Alzheimer's disease contributing to 15 to 25% of those cases worldwide. It will be possible for nearly every person in the world to be impacted by someone suffering from Alzheimer's or related dementia. Alzheimer's and dementias can and do impact younger individuals, and the frequency of early onset Alzheimer's seems to be on the rise. However, advancing age is a primary risk factor. Therefore, healthy adults 65 years of age and under are targeted for prevention. Prevention is imperative in combating this thief of memories, independence, and loved ones. Throughout this discussion, Alzheimer's may be referred to as AD. Alzheimer's is a chronic disease much like diabetes, cardiovascular disease, or asthma. The primary difference is there is no known definitive cause, prevention method, or management method. In 1907, Alois Alzheimer, a psychiatrist, diagnosed the first known patient, Auguste Dieter, shown in this photo. Although first described in 1907, this disease has only been seriously researched for the last 3 decades. Although age is a risk factor which cannot be mitigated, notable improvements in cardiovascular and cerebrovascular management may positively impact the incidence of AD. However, the U.S. has also seen a rise in the prevalence of diabetes, obesity, and hypertension, which could negate any improvements and potentially increase the incidence of AD. One interesting study, reported in 2007, is that of advanced education as related to AD development. Seniors with advanced degrees of greater than 8 years saw delayed onset of AD symptoms by more than a year. However, at onset, they saw cognitive decline at a much faster rate. While genetics are thought to play some role in the development of AD, lifestyle and environmental influences are thought to have the greatest impact on development. Researchers suspect most dementias, including Alzheimer's, share the same etiology as that of cardiovascular disease. Therefore, a heart-healthy lifestyle is likely also a brain-healthy lifestyle. Those leading the most active lifestyles are least likely to be affected. In addition, great attention is being paid to micronutrients such as magnesium and copper in the prevention of the disease. One of the most interesting areas of research is that of caffeinated coffee. Several studies indicate coffee can help prevent the development of Alzheimer's, specifically caffeinated coffee. Tea and other caffeinated beverages do not seem to extend the same level of protection, nor does decaf coffee. Statin drugs are also another promising avenue of prevention. Elevated triglycerides and cholesterol levels have been correlated with an increased risk of AD development. The use of statin drugs is not without controversy. Some studies have not shown significant improvement in patient outcomes with the use of statins. However, at present, with no other drugs offering at least the promise of improved outcomes, many clinicians continue to utilize the statin drug. The diagnosis of AD is frequently based on patient history and family reports of behavioral and cognitive changes. More extensive neuropsychological exams and imaging are the gold standard to determine the exact cause and type of dementia. Despite lack of abortive therapies and any foolproof method of prevention, there are some progression-modifying drugs available if an AD diagnosis is made early. At present, there are 4 FDA-approved drugs for treatment of Alzheimer's: Aricept, Razidine, Exelon, and Namenda. These drugs offer some hope for delayed progression if started early enough in the disease process. These medications work by improving acetylcholine signaling in the brain. Acetylcholine is very important for normal memory function and is thought to enhance cognition. Currently, the primary goal is symptom management. Alzheimer's patients frequently have problems with agitation, depression, psychosis, and insomnia. Life expectancy for a diagnosed AD patient is thought to be half that of someone the same age with the same risk factors but without AD. Estimates range between an average of 3 to 10 years for life expectancy after diagnosis. This is, of course, difficult to pinpoint because of the variability in the diagnosis timeline of individual patients. Understanding the life expectancy of the patient is crucial to planning for the individual's health needs and the impact on personal finances. Costs in the U.S. exceed $100 billion annually. The financial impact on families varies greatly due to severity and duration of the disease. It is difficult to accurately calculate costs due to variables such as lost earnings of caregiver and caregiver time. Long-term care costs are astronomical and frequently not an option for the average family due to financial constraints. Direct cost estimates vary between $18,000 and in excess of $77,000 annually. A 1999 study projected costs of $21,457 per year for an individual with severe AD. Caregivers deserve our attention as well. They suffer tremendous social, psychological, emotional, and financial burdens while caring for their loved one. Many are forced to quit their jobs to stay home and care for their loved one. In addition to lost wages, there are ever-increasing medical costs to add to the already stressful situation. Alzheimer's is a devastating diagnosis for both patients and their families. It is imperative the fight be continued to stave off this disease, this destroyer, this thief.